Thank you for participating in EMS Simbox. We are excited to have you join us today to practice your pediatric resuscitation skills with your facilitator. Before we begin, we ask that you pause the video and introduce yourselves to each other as well as to the facilitator. The purpose of today's session is to practice the management of a critically ill pediatric patient. If you are an EMS team that is present in person and has equipment, please use that equipment and the simulator to apply that equipment. The format for the simulation will involve a pre-brief, a 10-minute simulation where you will take care of the patient, and a 30-minute reflective discussion where you will explore opportunities for improvement. During the simulation, you will see a monitor on the screen with an image of the patient as well as the vital signs, and you'll have a facilitator present, and you may or may not have a simulator in the bed. The facilitators will be your eyes and ears during this case and provide most of the cues in terms of the physical exam and historical factors for this patient. During the case, we recognize that things can be confusing and ask that you use the power of timeout. At any time, if you would like to ask for a timeout, please do so. This can be for technical issues or brief huddles during the scenario. We believe that everyone participating in Simbox is intelligent, capable, cares about doing their best, and wants to improve pediatric care. And we ask that you take this seriously and engage the best you can. The simulation will begin with the words begin simulation and end with the words end simulation at the conclusion. What happens in sim during that time period stays in simulation, meaning this is not a method of assessing you or providing a grade. And lessons in simulation save lives. These are opportunities for improvement and chances to improve our real care of patients. The scenario will begin with a 2-minute countdown to debrief and prepare for the care of this patient. We ask that during that time you discuss what equipment, resources, and pre-planning you would do as if you were en route to the scene. And most importantly, have fun during this session. Dispatch, we're calling your unit to respond to the scene of an infant with vomiting. Mom reports the infant is also crying and they're approximately 7 months old. It will take approximately 2 minutes to arrive on scene. You are now arriving on scene. You see the infant with some clear vomit on the sheet. Begin simulation. Thank you for that handoff. That is the end of the simulation. We ask that you now move on to the debrief, but please provide feedback using the QR code on the attached screen to help us improve our pediatric simulations using SimBox. This feedback form can be completed after the debriefing, and we greatly appreciate all you do to take care of ill and injured children every day in the field and look forward to sharing more SimBox scenarios with you.